Dr. Margaret Goodman, a neurologist, longtime ringside physician, and currently the president of VADA, the Voluntary Anti-Doping Agency. Thank you for joining us today.
Thank you so much for having me.
Tell me a little bit about what VADA does, how often you're testing fighters, and then how that testing has been impacted by the coronavirus.
VADA was set up to improve doping in boxing and MMA. And since we started in 2011, we were up to testing, performing, I would say, 60 tests a month at least. Obviously, with the impact of the COVID-19, things have slowed down, but we have several fighters that have joined VADA that have fights that are upcoming. They may be postponed, obviously, as you might imagine, is what's happening in Las Vegas or in the state of Nevada, but we do have fighters that are still enrolled in VADA that are subject to testing. Some of those might include Anthony Joshua, Kubrat Pulev, who were supposed to compete in June. We also have Dillian White, Alexander Povetkin. We have the two women fighters, Amanda Serrano and Katie Taylor, which is a big fight that's supposed to take place. So we know that some of these fights will be postponed. However, the fighters are still subject to testing. Matter of fact, we were in contact with the promoter today. So our testing has slowed. We're obviously taking into consideration all of the recommendations from the CDC to make things as safe as possible. Most of our doping collection officers are healthcare providers, so they're fully educated on the needs to protect the athletes and themselves if they go to test.
Now, when you are at full power, how often are you testing fighters? Are you only testing the fighters that have upcoming fights, and how far out is that testing happening?
You know, it varies. As you know, we're the administrator for the World Boxing Council's program, and they have actually over 600 fighters that are registered in their program, but they decided to pause that program or suspend it for the time being. So we're not testing those individuals. They're not subject to testing. When fighters enter VADA, they may get tested 5 times before a fight. They may get tested 10 or 12 times before a fight, and then post-fight. The time period can fluctuate. For example, Anthony Joshua, who has done VADA a number of times, usually requires that his opponents and he start testing 3 or 4 months before an event. And we've seen that with other individuals. We've done that long periods of time for Canelo Alvarez, Gennady Golovkin, some of the other fighters. It just depends on when they sign the contract, obviously.
And some of the conditions of the contract.
Mm-hmm.
Now,
Yes.
as for the WBC, when they announced that they are putting their clean boxing program on hold for 3 weeks, and then they'll revisit the topic, but because of coronavirus and the inability of people to go and physically get these tests because of social distancing recommendations, what did you think about them coming out with that announcement?
Well, obviously, I wasn't really in agreement with that. I do understand that's their program. They have the right to make those decisions. We just administer the program for them. You know, I hope that this doesn't last too long. Obviously, the way our testing works is we do unannounced random testing. So we show up at the athlete's place of either training. Now most of the gyms are closed, or we show up at their home. One thing that we've instituted that is obviously the most important is we contact the athlete if we're going to test by phone first and ask a series of questions, just like any other physician might do, and I'm doing in my regular neurology practice. Before they would come into my office, I ask them if they've traveled, where they've traveled, if they've been to any hot spots, do they have any recent colds or flus or symptoms that could be consistent with COVID-19, which can actually vary. I mean, I was even hearing that patients can have difficulty with sense of smell or taste. So we're asking all those questions. We also are asking the athlete if they want to be tested, because under these severe circumstances, I can see that it could be concerning to have someone come into your home or your place of work unannounced like that. So we actually give them that opportunity to say whether or not they want to be tested. And then our doping collection officers are fully trained in what the CDC recommendations, when at all possible. Obviously, even in Las Vegas or Nevada right now, there's shortages of masks and gowns and gloves and things of that nature. So we're a little bit limited with that depending on where we're testing. The other thing that's very interesting is because we test worldwide, there's a lot of border closures these days. So, for example, in different countries, especially in Europe, we're privileged to work with an organization called Claridium, who has doping collection officers worldwide. So we have that ability, even if there are border closures, to have the officers in that specific country go. So, we're waiting to hear about some of the fights that are up and coming, like the Joshua fight and the Amanda Serrano, Katie Taylor fight, when those will be rescheduled, if they will be. And so we're aware that the testing that we'll do will probably be spaced out a little bit more. But those athletes are still eligible for testing. And it's my hope that soon the WBCs program will restart. They're continuing to enter fighters and educate fighters. A lot of this is anti-doping is education. So we're kind of taking this opportunity to educate the fighters. One thing that I haven't even announced yet that I'll tell you that we're going to probably be announcing in the next few days is since things have slowed down so much, especially for those fighters, that we're going to enable fighters to get their supplements certified and tested with Banned Substance Control Group. In that way, they'll be able to send to Banned Substance Control Group, have their supplements certified to make sure that they're free of any performance-enhancing drugs. So we're trying to take this opportunity to do that. We're also putting together some webinars and things like that to try to educate the fighters while things have slowed down.
So you have given fighters the option of not getting drug tested, though, and so if there were an opportune time for a fighter to cheat and use a PED, in your opinion, would this be it?
It's concerning to me. That's why I think it's important for fighters to know that they're eligible for testing. I think that's important. I think some of the other organizations have made that clear. As I think you and I were talking beforehand about the Olympics being canceled or postponed, we don't want that, just like we don't want with these boxers and MMA fighters to think that that's an avenue for them to pursue doping. So I think it's so important for the athletes to know that they're eligible for testing. And so that's what we're making it clear from anybody that's enrolled in VADA.
Explain to me, though, why they would want to volunteer themselves.
That's a good question. I remember when we started in 2011, I think that because of the concerns, especially the new things that you see with all the supplement usage and the fact that supplements can be contaminated with performance-enhancing drugs, you wonder why anyone would want to do that. But, one thing that I think both you and I have seen is most of the fighters want to demonstrate their commitment to clean sport. They want to make that part of their persona. Almost some of them want to do it as a challenge to their opponent if they have one. But what I've seen is most of the fighters that volunteer to this program, they're happy to do so, and they actually want to step up and show that they're clean, and they want everyone else to see that. And it's a wonderful thing to demonstrate to all the youths out there, especially those coming up in schools that are training in these endeavors. So we're happy that they do.
Have you received any feedback from fighters concerned that other fighters might use this as an opportunity to cheat?
Yes. I received several emails and text messages of athletes that are enrolled, not the ones that are enrolled leading up to a specific bout that I mentioned earlier, but other athletes, when they see that a program could be on suspension, they don't want to know that that's an opportunity for somebody else. I think most of the athletes, I can tell you that even though we probably have a higher percentage than just about any other organization in the world as far as finding athletes that have been using performance-enhancing drugs. In other words, the tests that we conduct, we probably have a higher percentage than WADA, the World Anti-Doping Agency, has as far as finding individuals that have adverse test results. But irrespective of that, the one thing that I have noticed is most of the fighters are trying their best to not use PEDs and to stay clean. And I think that there's probably more than there was before, a larger percentage that may have been using supplements that are tainted. And so that's why, at least during this time period, I'm hoping that the athletes themselves, being that they may not have a fight scheduled for several months, that they're using this as an opportunity to learn more about this. And that's what we've seen as well, contacting us with questions. We work with an organization called Axis, where athletes can ask those questions anonymously and get answers as to the risk of the supplements they're taking. So that's a good thing.
Are you ever testing fighters who do not have a fight scheduled?
Yes, we've had in the past fighters that join our program specifically in that manner. We also have had commissions that have had fighters previously test positive or had adverse findings, that part of their adjudication process was to join VADA. As you are probably aware, John Jones did that for a lengthy period of time. We've had other athletes, including other prominent MMA fighters, that have been and are currently in our program undergoing testing. And that's as a result of the adjudication process of that specific commission, that they've said, okay, your suspension will be this, and you will have to undergo VADA testing unannounced for this period of time, whether it's 6 months, a year, or even longer.
Okay. Would you say the majority of your participants are boxers, though?
Yes, yes, they have been. We're happy to do other sports, and we're happy to be involved in anything else. We do have some MMA fighters that have volunteered to VADA and are also currently undergoing testing.
And then the last thing, you mentioned John Jones. We were speaking with the UFC a little bit earlier, and they had talked about how their drug tests revealed something in his system from years and years ago, you know, tiny traces of it. Is that a warning to fighters who may be considering using this time?
Yes. As I mentioned earlier, I think the most dangerous thing can be supplements. The other problem with a lot of these supplements, and I was even reading this recently in a study, is some of the supplements that fighters are using that they test adverse for can have very harmful side effects. They can cause liver disease, kidney disease, heart disease. Even some of them can predispose them to stroke. So I think that this is a real strong learning curve for everyone, and we probably have to take advantage of this time as an education process for these athletes.
To make sure that
it's a dangerous time. Yeah.
To make sure their supplements are not going to register on a drug test, as well as impact their health possibly. Any message you want to leave with fighters watching this?
I just think the most important thing is for them to use their time wisely. Obviously, it's got to be more frustrating. It's frustrating for us as well, and it's frustrating for me as a neurologist in Las Vegas to try to keep my patients safe, free of this virus, but also stay healthy. So I think that, you know, if one thing that we're learning, and I'm sure you've discussed ad nauseum on your network, and will continue to do so, that it's important to stay healthy during this. That means to continue exercise. The other thing that I think is very important and may be very productive for a lot of these fighters is one thing that's always bothered me, and I think you and I have discussed this as well as a neurologist, that too much sparring isn't good. And a lot of these fighters are very well trained, that perhaps as time goes on, since they can't be in a gym setting, close contact with another individual to spar, that they stay healthy, they keep themselves clean, and they do physical exercise as well that may benefit them in the long run, save them from further trauma to their brain as time goes on. So I think maybe there's a positive way to look at this, and so I hope that that can be explained to the athletes as well.
Perhaps they'll find new methods of training that don't involve as much sparring.
Yes, very much so.
Dr. Margaret Goodman, thank you so much for your time.
Thank you for having me.